This video is about OET writing. If you have ever looked at those dense case notes and thought, where on earth do I even start? So this is your video. By the end, you will know the types of letters you might face and exactly how to use those precious 5 minutes of reading time like a pro. So the first one is the types of letters. You can encounter different types of letters such as referral letter, transfer letter, and discharge letter. So referral letter is example like a general practitioner referring a 72-year-old woman, Mr. John Matthews, with progressive memory loss to a neurologist for possible dementia evaluation. It's an example for a referral letter because a general practitioner is referring an old man to a neurologist. Okay, so he's referring a person. The next one is the transfer letter. A hospital nurse transferring a 48-year-old woman, Miss Emily Turner, with acute pancreatitis to a tertiary facility for ICU care. So the patient has been transferred to a ICU care, right? And the next one is a discharge letter. A physiotherapist discharging a 28-year-old athlete, Mr. Michael Harris, with a healed ACL injury back to his sports coach with exercise advice. So this is a discharge letter. Simple, right? Let's deep dive about the 5-minute reading time. Here is the case notes. So you're writing to a community nurse about Mrs. Sarah Collins, a 60-year-old widow recovering from pneumonia. For the community nurse, you focus on medication, adherence, oxygen support at home, fall risk, and dietary needs, right? So if the addressee was a respiratory specialist, you would focus instead on lung findings, spirometry, antibiotic response. Got it? So this is how you need to transfer your findings. Now let me tell you what to include, what to omit, and how to build your structure. The first one is the yes, yes rule. Example, Mr. David Thompson, 55, uncontrolled hypertension, admitted with a mild stroke. So, if you are referring this person to a neurologist, then what are the things that you need to include, or what are the things is required is relevant onset time, CT scan results, blood pressure readings, anticoagulation plan. Right. The things which are not relevant is if he had some seasonal allergies as a child, that was not required. And if he broke his finger in college baseball, that was also not required. So, whom you are referring to which specialist, based on that context, you need to give the relevant case details. Got it? Okay, so this is an example for a referral to a cardiologist. Okay, I'm referring Mr. David Thompson, a 55-year-old accountant with long-standing uncontrolled hypertension who presented with a recent ischemic stroke. In view of his poor blood pressure control and need for secondary prevention, I would appreciate your expert review and management. As simple as that, and it's very clear as per the context to whom we are referring to, right? Now, let's see a complete example. Here are the case notes, and this is a referral letter case notes. Patient name is Mr. Robert Miller, age 63, condition is worsening chest pain, diagnosed with unstable angina. Risk factors are smoker, type 2 diabetes, tests or ECG showed ST depression, troponin elevated. Treatment so far given is aspirin, nitrates, beta blocker. Current status is persistent chest discomfort and request is cardiologist review for possible angiography. And let's see how the referral letter should be. This one, we will start with the date and year. Doctor name, Dr. Amanda Clark, consultant cardiologist, City Heart Institute. Dear Dr. Clark, I'm referring Mr. Robert Miller, a 63-year-old retired engineer who has presented with recurrent episodes of chest pain and was diagnosed with unstable angina. Mr. Muller has a significant history of type 2 diabetes and long term tobacco use. During his most recent admission, ECG revealed acid depression and his troponin levels were elevated. He was managed with aspirin, nitrates, and a beta blocker. Despite this, he continues to experience intermittent chest discomfort. Given his persistent symptoms and risk profile, I would appreciate your expert assessment regarding the need for coronary angiography and further intervention. Please do not hesitate to contact me should you require additional information. You are sincerely Dr. James Foster, General Practitioner. Okay? All right, let's walk through this referral letter together. So, the first line we have mentioned Dr. Clerk, dear Dr. Clerk, I'm referring Mr. Robert Miller, a 63-year-old retired engineer, so and so with unstable angina, right? See how clean that is. Straight away, I've ticked the examiner's boxes because I have said who's the patient, how old is he, what is his background, what's the main medical problem. No waffle, no suspense, just boom. Here's the case. That's what a busy cardiologist actually wants to know right at the start, isn't it? Next, I went into the relevant medical history. So I have mentioned Mr. Miller has a significant history of type 2 diabetes and long-term tobacco use. So why did I choose those two? Because they are big risk factors for heart disease. I didn't bother mentioning, say, a knee replacement 15 years ago because that has zero impact here, isn't it? So this is the filtering skill OET examiners are checking. You know what matters and what doesn't. Okay. Now look at the current admission details. So ECG revealed ST depression and his troponin levels were elevated. He was managed with aspirin, nitrates, and a beta blocker. Despite this, he continues to experience intermittent chest discomfort. So this paragraph is gold. Why? Because I have shown the sequence. I have given the test result followed by the treatment and the response. So that gives the cardiologist a full picture. Then comes the request paragraph. So, given his persistent symptoms and risk profile, I would appreciate your expert assessment regarding the need for coronary angiography and further intervention. See how polite but direct that is, okay? I have made it crystal clear what I want. Please assess him for angiography. The examiner loves this because it shows you're not just narrating a case, you're actually requesting the right next step for the right professional. And finally, the closing line. Please do not hesitate to contact me should you require additional information. That's just a standard professional way to sign off. It shows courtesy and keeps the doctor open for a follow up. So, overall, what makes this a high scoring OET letter? The intro is very sharp, no vague stuff. And the history is filtered only what matters for the heart problem. The current situation flows very logically. So we have started with the diagnosis and what are the results, the treatment, and the outcome. And if you see the request, that is also very specific, not just further care, but angiography and possible intervention. So that's all for today's video. Kindly like, share, and subscribe for more OET tips. See you in the next video. Bye for now. Bye bye.